and welcome to Dr. A for Animals, the podcast that gives you reliable answers to your questions about animal health and wellness and useful tools to help you help animals, whether in your own home or out in the wild. Together with expert guests, I'll give you information that is based on scientific research and clinical experience. I'm Dr. Charla Ansorge, a small animal and exotics veterinarian, and I'm so happy to share my love of animals with you. Let's get started. Hello, my friends. I'm here to talk to you today about diagnostic testing in your animal friends. So this has happened to many of you, I'm sure, when you've had a sick animal that you've had taken into the vet. You've started with something like a blood panel. It was normal. Maybe they had x-rays, didn't find anything. Now your vet's recommending some much more expensive tests like an ultrasound or maybe an MRI. Why were all those other tests done if they weren't going to get an answer? Why do they just keep recommending more tests? Or you come in with your healthy pet for an annual exam and your vet recommends a blood panel and your gut response is, why do they need that? They seem fine. Well, there are reasons, and I want to talk to you about what those reasons are for those kinds of scenarios because they can be very frustrating, especially if you have a sick pet who isn't getting better and we're not finding any answers on all of these tests, which are costly often and can be stressful for your pet who you love and you don't want to be stressed out. Medicine for animals is really difficult. Those diagnostic tests are all we have oftentimes to tell us what might be wrong with an animal who has especially very vague symptoms, which is quite common, unfortunately. And I'll also say it's just as frustrating for the doctor who is not getting an answer from all their diagnostic tests because we always hope that our tests are going to give us an answer and something that we can fix for your beloved animals because we love them too. So let's talk about what we even mean by diagnostics or diagnostic testing. Diagnostic tests are tools that doctors use basically to see inside the body beyond a physical exam. So this might be blood work, x-rays. It might be a fine needle aspirate or poking a needle into something like a mass on the skin or even maybe somewhere in the abdomen or in the chest. It may be a smear from a swab of something or from pressing a slide up against the skin, perhaps swabbing the ears, or could be bacterial culture. It could be advanced imaging like a CT scan or an MRI, very specific blood testing. There are all kinds of different tests that all fall under diagnostics that are helping us to try to diagnose disease. Since animals cannot tell us what's wrong, a physical exam can only tell us so much. The history that you provide to the doctor also is really important for trying to help us figure out which tree we should be barking up. Testing is really necessary kind of detective work to try to find a possible cause for illness in an animal who can't tell us, hey, I just have a stomach ache, Sometimes they'll give us a signal. Sometimes their history will point us in the right direction, or we'll find something on physical exam that tells us, ooh, this is where the problem probably is. But oftentimes we don't. We can have a completely normal physical exam in an animal that is significantly ill. It's also super important to understand there is no single inexpensive, perfect lab test that can diagnose any problem under the sun and that never gives an incorrect or inadequate result. Unfortunately, we don't have this for humans and we certainly don't have it for animals. If whatever's ailing them doesn't create some outward physical sign, then we can often be completely in the dark as far as which test is most likely to give us an answer. Might it be blood work? Might it be imaging? Something else entirely? There's no way for us to know that in advance, unfortunately. So I'm going to talk you through how we go about figuring out what diagnostic tests need to be run and why we run them in certain situations. So firstly, I'll talk about early detection of disease in animals who appear healthy. And that's kind of your annual lab test. And people get this too. There's plenty of stuff that can be going on with us internally that we didn't know was happening. My cholesterol ended up high on my last lab work. Where did that come from? How did, I don't feel like my cholesterol's high. I exercise, I eat great. That kind of stuff can show up and can be an early signal that something more sinister can happen down the line if we don't intervene soon. And that's why we're doing annual lab testing on our animals as well, because a lot of illnesses are completely silent early on. Kidney disease, even diabetes, thyroid disease, these things can be really difficult to know that they're there early, and they can become deadly without early intervention. Early detection means we have more treatment options and we have better outcomes. We have longer disease-free periods or symptom-free periods of good quality of life. Whereas if we wait until an animal is clearly sick and then we find advanced disease, we may have missed our window to help them at all, especially in the case of something like cancer or kidney failure. If we don't intervene soon and we diagnose the disease when the animal is clearly very sick, we probably have missed our opportunity to help them through it. Often results on our annual labs are normal, and that is still valuable. That gives us, an established baseline for a younger, healthy animal. Because normal, in quotes, varies by individual. So what's normal for one cat might be low for another cat. So part of what we're looking at when we're doing lab work on a younger animal who's totally healthy, when we start doing somewhat regular, maybe annual or every other year in a young, healthy animal, we're looking at what has been normal for that animal over several years. And if that all of a sudden has changed, even though it's still falling within the normal range, that might signal us that something is going on internally and we need to be paying more attention. It helps us to track changes over time for that specific individual. So those annual labs or semi-annual labs for generally healthy animals are still very helpful. So pre-anesthetic screening is another reason that we may do lab work on an apparently totally healthy, normal animal. Screening before any kind of surgery or a dental procedure is super important. Even in a really young animal, I have a few times uncovered a serious disease like a congenital kidney defect that is going to lead to kidney failure at a very young age. Those animals don't have any symptoms when they're very young, and they can live to be a couple of years old before they start having symptoms. But if we put an animal like that under anesthesia, we could severely compromise their health much, much sooner. So pre-anesthetic lab work, and definitely in older animals that could have early signs of other problems going on, that lab work can identify a hidden risk and help us to modify an anesthetic protocol if necessary for an individual animal, because we always want to be tailoring our anesthesia to the individual. It's extremely important. Lab work is also, or other diagnostic testing is also really important for monitoring chronic conditions in animals like kidney disease, endocrine disorders, anything like that we need to be tracking how it's doing over time so that we know if we need to intervene with new medications or changes in their treatment plans. Or if we have an animal on chronic medication, say for arthritis or diabetes, anything like that, we need to be monitoring how they're responding to that medication and if we're seeing any adverse effects over time from chronic medication. And of course, we're going to be running diagnostic testing when we have an animal that is ill and we are trying to find a cause for their symptoms. So an animal that's showing clear symptoms like they're chronic vomiting or acute onset of vomiting, they're losing weight for no apparent reason, they're just acting not quite right, anything like that, we pretty much always are going to start with what we call a minimum database. This is casting a wide net to detect a lot of common abnormalities that give us a general overview of organ function, immune function, electrolyte balance, and the cost for that sort of minimum database, which is generally a complete blood cell count, a blood chemistry panel, and a urinalysis. The cost is usually not exorbitant. It's certainly more than it used to be, unfortunately. As we know, everything has gone up. Everything has gotten more expensive these last several years, especially since COVID, and lab tests are not exempt from that, unfortunately. But this is one that we can't skip. In a sick animal where we're trying to find a diagnosis, this is where we need to start. So it may not give us the answer, but it tells us a lot about their overall health and how their organs are functioning and if there's something that we really need to address. So if we don't find an answer on that initial kind of wide net, we have to proceed from there. So from this minimum database, if we either haven't found an answer or if we've found an abnormality, but it's not specific enough to tell us why the animal is sick, we probably need to proceed from there and do additional diagnostic testing. So I'm going to walk you through kind of different types of diagnostic tests that are commonly used in veterinary medicine. And then we'll talk a little more about how we choose where to go next. So that basic complete blood cell count and chemistry, what that's evaluating, firstly, we're looking at the blood cells. That's going to tell us about immune function. It can often give us a signal that there is infection present or inflammation of some kind. It can suggest allergies or parasites. It will tell us if there is anemia or a low red blood cell count, which can have a multitude of underlying causes, but there are changes in the cells themselves, in the presence of immature cells and that sort of thing that can help us to rule out some of those underlying causes. Sometimes we'll find an elevated red blood cell count. We might find white blood cells that are suggestive of a cancer that's coming from the bone marrow or the lymph nodes. That's somewhat rare that we find it in the peripheral blood, but we can. Occasionally we'll turn up a blood parasite like mycoplasma in cats or malaria in birds. That complete blood cell count usually doesn't tell us a specific cause of illness. It tells us stuff is going on, but commonly it doesn't tell us something specific. The blood chemistry panel is where we're looking at organ function, so liver and kidneys. We look at blood glucose, so that's going to tell us if there might be diabetes or if there's a low blood glucose for some reason. We're looking at electrolyte, balance minerals like calcium, and we can see signs of inflammation and immune response also in the blood chemistry panel. So that type of panel is often what's recommended at the annual exam for a well animal, and it may be a relatively small chemistry panel or a more extensive one depending on the age of the animal and the species of the animal. With any systemic illness, unexplained weight loss, pre-anesthetic screening, anything like that, that's generally the test that we're doing, and often along with that is a urinalysis. The urinalysis helps us to understand the kidney function. So that is a really important part of evaluating kidney function. It also will help us to uncover urinary tract infection, crystals forming in the bladder, inflammation in the bladder, protein leakage in the urine out of the bloodstream. Rarely we may find cancer cells in there that we usually don't. Even when there's a tumor in the bladder, we often do not find cancer cells in the urinalysis, but sometimes we can. Now, in many, many vet hospitals, an ultrasound of the bladder is included in the urinalysis. We always do that at our hospital because we are always checking for the presence of something like a tumor in the bladder, which if we poke a needle in that's a bad thing. If we poke a needle in a bladder mass, that is known to potentially seed tumor cells through the body wall. So we always are checking the bladder for something like a mass before we take our sample just to make sure that it's safe. We also can often see if there's a stone in the bladder, signs of inflammation, so thickening of the bladder wall, or often we'll see stuff kind of floating around in there that is not normal. The urine should look very clear or maybe just a teeny bit sparkly on our ultrasound image. So if we're seeing there's a bunch of stuff floating around in there, we know that something is going on. And the ultrasound alone, we may run an ultrasound on its own when we have an animal that we think probably has a urinary tract infection or they're urinating inappropriately in some way and we're evaluating for any signs of inflammation. So we may do a urinalysis on its own, but it's often paired with that CBC and chemistry when we're looking for a full picture of, organ function and all that kind of stuff. We also have specific blood tests when we're attempting to either find or rule out a specific disease. So that might be an endocrine or organ disease. So there are some adrenal gland diseases where we might be running a very specific blood test that might have to be done over several hours where we're taking a baseline and then we give a medication and then we take a couple of follow-up samples a few hours later to see how they responded to that medication. Or it may be something simple like thyroid levels that we can just add on to that regular blood panel. We may be running a panel for infectious diseases. So we're looking for either DNA components, and that's a PCR test, or we're looking for antibodies in the bloodstream to specific diseases that might tell us that there is an active infection present or that there has been exposure at some point in the past. Some of these tests require some interpretation and they can have gray zones. They can be thrown off by comorbidities or a concurrent illness. So even though we're doing a blood test for a specific disease, it doesn't mean that we will get a definitive diagnosis of a specific disease. Sometimes even with those very specific tests, it can be a little equivocal. So they may increase our suspicion of that disease or make it less likely, but they're not necessarily 100% right, which is frustrating. Frustrating for us, frustrating for everyone when we get an answer that's kind of in that gray zone, and so then we're still not sure. But they are often incredibly helpful at diagnosing specific diseases, which is what we're always hoping to do when we have a sick animal, is to find out exactly what the problem is so that we can start treating it. So fecal testing is another one that you probably have encountered with most animals. We're doing fecal screening for roundworms, tapeworms, protozoal parasites like Giardia or Coccidia. These are all quite common. There can be advanced fecal testing for viruses and bacteria. So it's important to realize if you have an animal that's having diarrhea or something like that, and you bring in a fecal sample and we run a general fecal test, if that all comes back normal, that doesn't mean that there's not a bacterial infection or a viral infection or something that's causing diarrhea. Regular fecal testing that you run kind of on a regular basis, that's not going to detect those things. That's only detecting parasites. So it's worms and protozoal parasites. But these tests are important to run even in our indoor pets for kind of annual screening, because a lot of those parasites are somewhat silent. So we can have a pet that's carrying parasites and may have kind of mild symptoms or potentially no symptoms if they're carrying a pretty low parasite load. But even indoor pets, that they eat a certain insect or something like that, or they get exposed to fleas that can come in through window screens and things like that. Fleas carry tapeworm eggs. If a cat is grooming and swallows a flea, even just one can be enough for that indoor kitty to then get, in addition to the fleas, tapeworms. So, just looking for this kind of thing on a regular basis, some of the signs can be minimal to none, but that doesn't mean that there's not parasitism present. So those are the most common types of diagnostics that are kind of run even on healthy pets on a regular basis. X-rays are also super, super common. And just so you're familiar with terminology, the X-ray is actually the ray of energy that is passing through the animal and being captured on the image. The image itself is called a radiograph. So if your doctor mentions radiographs, or you see radiographs on your invoice or something like that, it's actually a radiograph. A lot of people are not familiar with that term, so we call it an X-ray, even though technically that's incorrect. The image that you see is not the X-ray. The image is a radiograph. The X-ray is the beam of energy that produces the image. So just some fun details there. So X-rays are really excellent at seeing mineral densities. So bones are really easy to see on X-rays. But we can see other tissues. We just can't see them as well. We can't see certain details on X-rays. So we can see a lot of the tissue in the lungs. We can see the heart, abdominal organs. We can see them to some degree, but we can't see, the architecture of those organs. We may not be able to see if there's a small mass tumor in an organ. We can see stones pretty well that are, as long as they have mineral in them that is opaque to those X-rays. We can see certain types of foreign bodies. So if an animal has eaten a stone, a rock or metal, we can see that in the X-ray. Now, if there's something that's not a density that will show up on that image, so like plastic or fabric often will not show up, or it won't be, or we simply can't tell the density. There's not enough difference in density from soft tissue that we can't see it. Fluid also obscures the image that's created by X-rays. So if there's free fluid in the abdomen, or there's free fluid in the chest, that will obscure the rest of the image. Anything that's behind or beside that fluid will be difficult to see. Where fat actually will clarify radiographs. So we have less detail in an underweight or, skinny little animal, and we have actually really good detail on X-ray images for kind of overweight animals or animals that have a bit more padding in there. So some animals will need some sedation for X-rays. It depends on the patient. It depends on what we're X-raying. It's important that the animal be still for several seconds, and sometimes they're in kind of an odd position. If they have an injury, perhaps it's a broken leg that we're trying to get an X-ray on, they're going to be painful. We can't be just moving that leg around into the position we want and then holding it there in an animal that's having excruciating pain. So we need to give them pain control and sedation oftentimes for that kind of an image. And sometimes we need to have them in a very specific position. So for instance, if we're trying to get X-rays of the spine around the neck, we need to have these little wedges in there. We have to have them very, very still in a weird position. Sometimes we just can't do that with an animal that's awake and is going, "What are you doing?" The X-ray machine also makes a loud beeping noise when it's right before it takes the image. And some animals, that really freaks them out. So right as it's about to take the image, they'll jump because they hear the beep. And that's that doesn't work. So sometimes we need to sedate them just to be able to get those x-rays. And in some cases, even with that blood work, depending on the animal and, how tense they get with being handled, sometimes we need to sedate animals just to get a blood panel as well. So times we may need x-rays. So I mentioned, an injury, if we're assessing for broken bones or other injuries, dislocations, that sort of thing. Certainly x-rays are really good at detecting that kind of thing. Patients that are having lower respiratory symptoms, so not up in the nasal passages, although sometimes we may use x-rays to evaluate nasal passages, but definitely in the lungs. If we think there may be pneumonia, if we're looking for asthma, if we think there may be free fluid in the chest, heart failure, we definitely are wanting to evaluate that on an x-ray. If we're looking for a possible obstruction in the GI tract or a mass in the abdomen, x-rays can be extremely helpful there. We often will use them also in pre-anesthetic screening for geriatric patients because sometimes we have an elder patient who actually has a tumor lurking in the chest or something else like an enlarged heart where they're not having any other symptoms and there aren't any signs that we can detect on a physical exam. So we are often recommending taking x-rays in a patient that's going to be going into anesthesia, even for something very routine like a dental procedure, just to make sure that there's not something more serious brewing in there before we go and do this other, somewhat elective procedure. We also use x-rays, of course, in our dental procedures where we're doing little teeny bitty x-ray imaging of the jaw and the tooth roots. So that is extremely commonly used. Most veterinary practices are taking radiographs pretty much every day, often multiple times a day, and especially in emergency settings, x-rays are going on all the time. Another type of imaging that's very commonly used in general practice and emergency and specialty practice is ultrasound. As I mentioned, we often are using ultrasound to evaluate a bladder before we go and poke a needle in it for a urine sample. Ultrasound has really good soft tissue detail, so it is strong where those x-ray images are not so strong. And on the flip side of that, ultrasound doesn't go through bone, so it'll reflect off of bone or other mineral, and it can't really penetrate that well. It doesn't penetrate fat or gas well, but it's really great for soft tissue or fluid. So if we have fluid in an abdomen, ultrasound loves that. It goes right in there, and we can see that. We can see the fluid, and we can see the organs around the fluid quite well. So if we're looking for detail in the organ tissue itself, if we're trying to find a mass within an organ, if we're evaluating a pregnancy, all of those things are really well served by ultrasound. Echocardiogram is ultrasound of the heart. It's very specific to the heart. We generally are using a different type of probe on the heart that gives us different information from some of the other tissues that we might be evaluating. We use a different size probe and a different frequency for different types of tissue and different size patients. So if we're working on a really big patient, we need a lower frequency wave to look at their larger organs, where if we're looking at like a bird and we want to look at their liver, we need a very high frequency small probe in order to look at that. And again, we may need sedation for ultrasound depending on the patient, but for animals that are pretty comfortable being handled and they're comfortable enough lying on their back, often they're on their back for an ultrasound, although not always. We don't need sedation. The ultrasound itself can be uncomfortable. If you've ever had one, if you've had that probe pressed up against your full bladder or something like that, it can be a little physically uncomfortable, but that's generally a brief, a few seconds of discomfort as the probe is looking at that one spot. They're generally not painful unless there is an area of tissue that is quite painful. That is what we're looking at, then it can be painful. If that's the case, or if the animal is just very scared or nervous, we may need sedation for an ultrasound. I had a kitty in the office yesterday who absolutely, definitely needed sedation for an ultrasound and potentially for any handling at all, because some animals are just really, really freaked out by even getting in the car, much less getting to the vet and being handled by strangers. So we may use ultrasound for certain types of injuries, for certain types of illness, if we have unexplained symptoms, unexplained weight loss, chronic GI symptoms, and our other testing has been negative or normal. If we want to remove fluid from a body cavity, so if we have fluid in the chest and the animal is having difficulty breathing because that fluid is pressing on their lungs and taking up space in their chest, we need to get that fluid out of there. So we will often use ultrasound to guide us in getting that fluid. If we have abnormal tissue. So we have identified, perhaps throughout the liver, there's abnormal tissue, or we have a mass somewhere in the abdomen, or we have enlarged lymph nodes in the abdomen. We'll use ultrasound guidance in order to collect a sample from a specific spot so that we can send that sample then out to the lab to evaluate for something like cancer or infection. We'll often also use ultrasound for staging cancer patients prior to treatment. So if we're looking for spread of cancer to other parts of the body, and I think I didn't mention that with x-rays, but chest x-rays are often used for that as well. So before we go and say do a surgery to remove a certain type of mass that might be in the skin or just under the skin, we'll often take chest x-rays and perhaps abdominal ultrasound to make sure that we don't have obvious spread of cancer before we go and do that surgery, which removing the primary tumor isn't necessarily going to be helpful if it's already spread to other parts of the body. So more advanced imaging would be, as I mentioned before, MRI and CT, which is computed tomography. MRI is magnetic resonance imaging. So that's not X-ray. It is a completely different technology. It offers much greater detail for soft tissue structures. So we use this for imaging the brain, lungs, joints, that sort of thing. The MRI is really excellent for. It's one of the best ways to evaluate any kind of neurologic tissue, brain and spine, which is surrounded by bone. We cannot get past that bone with an ultrasound beam, and we can't see the soft tissues well with an X-ray. We can see the bone just great, but we really can't see the brain. So we take an X-ray of a head, we see the skull, we don't see the brain. So MRI can give us a really good image of the brain. We often with an MRI, there's a contrast agent that's given intravenously to help bring out contrast between certain tissues, and that can make it easier to identify small lesions. So there's no radiation with MRI, but if you've ever had an MRI, you may know it's extremely loud and it does take some time. So this does require general anesthesia for animals. And this is generally done at a specialty hospital or a university hospital. So most general practices are not going to have MRI. We have to send you somewhere to get an MRI done. And then CT, which is computed tomography, that is radiation. So similar to X-ray, but a little bit different. It's very good for bone diseases and other structural disease. It is still often utilized for certain soft tissues. It's a little less detailed than MRI, but we can use CT for brain lesions and that sort of thing. It's more radiation than a regular X-ray, but modern technology has really minimized that as much as possible. And this, again, we may utilize IV contrast to bring out smaller lesions, increase that contrast between different types of tissue, because different tissues will take up that contrast material in a different way. So it can help to identify lesions where non-contrast CT or MRI might miss that. And again, with the CT, it does require general anesthesia. It's usually a little bit shorter than the MRI, but this will, again, be done generally at a specialty hospital or a university hospital, although some ERs do have CT now, which is great. And then there is a special form of CT called cone beam, which is a 3D CT image, and that is used in advanced dentistry and oral surgery. So that, again, would be at a specialty hospital that has a dental specialist. And that's the bulk of the advanced imaging that's used in veterinary medicine. So let's talk a little bit about sampling actual tissues or maybe some goo on an animal. So this is cytology and histopathology from a biopsy. So cytology is generally a small sample of cells from a lesion that we are smearing on a slide, and then we'll stain that with some type of a stain so that we can tell different cells from each other, and then we'll look at that under the microscope. So this can be a fine needle aspirate, which we may poke a little needle into a mass or some other lesion and get a little bit of those cells out and then pop those onto the slide. That cytology, because it's such a small sample, for certain types of lesions, it can be perfect and give us a diagnosis right then and there. We can often be doing that in the office, in a general practitioner's office. But because it is such a small and unstructured sample, so it's not a chunk of tissue, it's just a few little cells being sucked out. Sometimes we only get the fat around the outside of a mass, or sometimes we get dead cells that are in the middle of a tumor. Our technique that we use usually helps to minimize that. But some types of cancer, so if we're getting a sample from a tumor, some types of cancer don't let go of their cells easily. So mammary carcinoma is a good example of that, where we may go in there and get our little sample and it just doesn't give us any cells. So we can get a negative on a cytology, or we may just not be able to identify the disease with just a bunch of cells because we need to see the structure of the tissue. And that's often the case with something like liver tissue, where we really need a chunk of tissue, so a biopsy, in order to get a diagnosis. So a fine needle aspirate or a smear, an impression smear, which is where we actually just smush the cell up against the lesion, those can be great for a lot of things, but they don't necessarily answer every question. So we'll often use this for diagnosing ear infections, skin infections, things like that. And certain types of tumors, like a mast cell tumor is a great one that often will give you all of its cells and tell you right away that that's what it is. But there are a lot of situations where a cytology sample is not going to give us enough information. So that's where biopsy, and then we send the biopsy sample, which is the chunk of tissue, out to a lab, and then the pathologist will perform histopathology, where they're taking little micro slices of that tissue, and they will look at that on a slide with special stains. And that, because it maintains the structure of the tissue and all of the cells in that layer of tissue, that can give us a lot more information. So these can be really, really helpful with like chronic inflammatory skin lesions or many, many types of tumors. It can be a really small piece of tissue, or it can be a whole organ. So say we've identified a mass in a spleen and it's bleeding into the abdomen, and we take that whole spleen out and we send the whole thing out to the lab. Or if we have a tumor in a leg and we're actually having to remove the whole leg, we might send the whole thing to the pathologist to look at. So it may be something small, like a lump or a mass in or under the skin or in an organ of the body, or it may be an entire organ or huge chunk of tissue. So histopathology is better at giving us a diagnosis oftentimes than cytology, but it's not always doable, because you definitely have to at least sedate. If it's a small biopsy, it might be doable under sedation. If it's a large sample, like we're removing an entire mass and we're going to send the whole thing to the lab, we're generally doing that with general anesthesia. We also will use histopathology when we know that we have a tumor and we're removing the whole thing and we're sending it out to evaluate, in large part to see if we got everything out, because tumors will be sending little tendrils of cells out along their periphery to try to invade the tissue next door. And those can be microscopic for a while before they grow into more, obvious tumor tissue. So when we remove a tumor, we're usually taking a pretty wide border of what looks like normal tissue. So we're generally taking at least a couple centimeters of normal tissue if we can, depending on where we are on the body. Sometimes there isn't that much tissue. If we're taking something off of an eyelid, obviously we're not going to be able to get that big of a margin. But we're doing that because we're then going to send that out to the lab and have them evaluate the margin by that histopathology evaluation, so that they can see if there's microscopic extension of those cancer cells into all the way to the edge of what we removed. And if that's the case, then if we didn't get what we call a clean margin, we either have to do more surgery or follow with other treatment. So sending that chunk out, even though we think we're removing the whole thing, it's really important to send it out to make sure that we got the whole thing. We also get a much more specific identification of what it is, and that can help us to decide if we need to do more treatment. So if this turns out to be some very high-grade tumor, that may tell us, even though we haven't identified spread anywhere else in the body, it probably is there based on the type of tumor and how aggressive this particular type of tumor usually is. It may tell us we really need to follow this with chemotherapy or something like that. And then there's some other advanced diagnostic testing. I mentioned things like cultures earlier. We can culture for bacteria or fungus. There are viral cultures too, but those are not really used in general practice. Those are generally used more in a university or research setting. But bacterial and fungal cultures from urine, blood, skin samples, gallbladder, fluid somewhere in the body, all of those kinds of things we might be sending out for a culture. Cultures take a few days to run. They have to be in an incubator with basically food for the bacteria or fungus that we're maybe hoping to grow. There is specific infectious disease testing, which may be from a swab that we take from the mucous membranes around the eye, the back of the throat. It may be from a lesion itself, something like that, where we're testing for a specific disease. We can do allergy testing by either skin patch testing or blood serum. There's genetic testing that we can run that can tell us about breed-specific disease risks and breed background, which is always kind of fun. There's eye testing that we can run, so we can check pressure, we can check tear production, we might do a stain on the surface of the eye to look for an open wound. More advanced testing on eyes is generally done with a specialist. There are so many different tests out there. I mean, just hundreds and hundreds of different kinds of tests on different kinds of tissue in the body. Some of those tests give us a really black and white yes/no answer regarding a specific condition. So for instance, if we get a blood glucose back that's, 550, that animal has diabetes. There's really not any other reason that we're going to get a blood glucose that high. Other answers are more general. So ruling out certain conditions is often just as important as confirming that they are present. So normal results are still helpful. They don't tell us everything, especially in a sick animal, even in a apparently well animal, our basic blood tests and that sort of thing won't tell us everything. And even in these specialized tests, a normal result doesn't tell us the whole picture. It doesn't tell us then, well, what is wrong, but it does tell us what's not wrong, and we can cross that off our list. So I won't go into more detail about all of the specialized testing out there because that list is endless. So let's talk now about how the doctor is deciding what kind of tests to recommend to you, because there are so many. Partly it's going to be based on the age of the patient and their overall health status. So, if this is a puppy or a kitten that's going to come in for a spay-neuter versus, a senior geriatric animal, or a bird or a rabbit, a fish, partly it's going to be based on that, who they are, what their species is, what their breed is, what potential breed predispositions there may be. So if you have a Doberman puppy that's going to be spayed, we might be running a von Willebrand's test, because it's relatively common in that breed, and that's a bleeding disorder that we don't want to be unprepared for if we're doing a surgery like a spay. So this is how we are deciding, the age of the animal and what's going on with them, what their lifestyle is. Do they go outdoors? Have they traveled recently? Are they showing certain symptoms? We do have fewer specific tests available for a lot of the exotic animals, and testing for exotic animals can be really limited by their body size, or if we have a very debilitated patient. So if we have a bird that's really debilitated, we may be really limited in what we can do just because they can't tolerate the stress of the handling for diagnostic testing. If we have a super sick little 5-day-old kitten, we can't run a full giant blood panel on them because they don't have that much blood to give. So there are limits to what we can do. Even if the test exists, we may not be able to run it in a certain patient just because of their condition or their size or their age. Based on the lifestyle of the animal, so indoor cats versus outdoor cats, we might be doing specific viral testing on a regular basis for an outdoor kitty. With an indoor kitty, we're not really worried about stuff like feline leukemia and FIV if they have been tested in the past and we know their status and they haven't been outdoors or exposed to other cats. We might be testing for exposure to certain diseases based on where we are geographically. So heartworm, for instance, is more prevalent in warm and humid climates. So we may be doing more frequent testing for that versus just having animals on a preventive in an area where it's not as common, but it still potentially can happen. And of course, we're basing our decisions on any symptoms that are present, any physical exam abnormalities, or certain needs. We might be running a rabies titer test because you're going to be traveling with your pet to Hawaii. So sometimes we have to do tests for other reasons that are not so much medical. There's no one size fits all. There are some tests that are used very frequently. Like I mentioned, that minimum database, we're going to use that on a large number of different types of patients. That's going to be a starting point for many, many, many different situations and many species and many ages. But we also need to tailor our testing to the individual pet based on their needs. So the vet may decide this is my primary concern, and here are the tests that are most likely to give us useful information, ideally for the lowest costs and the least amount of stress for the patient. So we're having to take all of that into consideration, especially with a sick animal. We're thinking about the history that you provide to us of what you are seeing that is of concern at home, the physical exam that we've done, their species, breed, age, lifestyle, potential exposures, and what we think might be going on in order for us to decide, okay, without spending $500 million and stressing the heck out of this animal, what tests can I start with now that might give me an answer? So we're also trying to avoid running diagnostics that are not going to change our treatment plan or the outcome for the patient. So I don't need to DNA sequence the herpes virus your cat has in order to treat them for herpes virus. I don't even necessarily need to know for certain that your cat has herpes virus to treat them for an upper respiratory infection. And sometimes a treatment trial is the diagnostic tool. That's not always safe to do, so it's not always an option. But sometimes, in some cases, that is the route that we go. Depending on the situation, the patient, the safety, and how much we discuss it with you, the family, sometimes what we're doing is, let's try this medication and we'll see if it works. If it works, confirms that this is what we think it is. And if it doesn't work, we will have to go from there. But all of that is to say, there is no perfect test. I wish there were one perfect test that could diagnose any disease in one fell swoop and that didn't cost much to do. A full blood panel can be completely normal in an animal that has cancer. And that happens a lot. This is why we sometimes have to keep adding on more tests when we're not finding a clear answer. I know it's frustrating. It can be exhausting when we have a sick animal that we're not finding a reason for their illness, and we have to keep going further and further down this diagnostic trail. But there are only so many symptoms an animal can show, and that those symptoms can have a wide variety of underlying causes. So an example would be vomiting. Vomiting can be from an infection in the GI tract. It can be from foreign material that's blocking the stomach or intestine. It could be from a neuromuscular disorder that's affecting GI motility. Inflammation in the pancreas, that's not even the GI tract, it's just nearby. Could be from a toxin exposure. It could be from kidney disease, liver disease. It could be caused by an inner ear infection. It could be caused by an endocrine disorder, central nervous system disorder, various types of cancer that may or may not be in the GI tract. You see where I'm going with this? Just vomiting alone, that one thing that is so super common, can have 100 different underlying causes. So this is why it's so hard. We can ask the pet, but we can't have them tell us. Unfortunately, did you eat a rock today? Or, did you eat a spider yesterday? Or have you been feeling kind of crummy for the last 2 weeks and now it's just gotten a lot worse and now you're vomiting? I recently read a case study of a Cocker Spaniel that was having these intermittent episodes of just fearful behavior, shaking, hiding, not eating well, occasionally vomiting. And this would last for hours to days, and then it would go away. And this had happened repeatedly. Over the course of time, this dog had had blood tests, he had had x-rays, he had an MRI of the brain and spine. He had trial treatment with anti-seizure meds, trial treatment with pain meds, nothing. No, he didn't respond to anything. They never found anything abnormal. Finally, one vet that was treating him thought, I wonder if dogs get migraines, because some of the stuff he's doing seems like when I get migraines. And they treated him with a drug called topiramate, and the dog got better. Not a single test could diagnose her problem. Think about that. How do you diagnose a headache? In humans, we say we have a headache. There's no test that will diagnose a headache. I've always wondered about this. How could I know if this animal just has a really bad headache? We have no way to know this. How can we possibly know if an animal just has a bad headache, like a migraine or a cluster headache? They may be showing signs. They might be lethargic. They might be hiding, sleeping a lot, not eating well. They might have a pinched facial expression, which can be quite subtle. And we may not recognize that at home. Vets may not recognize that. None of those are specific to headache, and none of them are even an obvious indicator of headache. We may occasionally see an animal head pressing, so pressing their head against a wall or even maybe rubbing at their head, but that's actually pretty rare. I give that example and the vomiting example just to clarify why diagnostic testing is so important, but also so difficult. and why it's impossible to know in advance which diagnostic test is going to give us the answer we need to treat the patient. We have to start with the basics that give us a broad look at overall health and then narrow it down. And unfortunately, that can take time. It definitely costs money, and there can be some stress involved for the animal depending on the patient. It's always going to be somewhat uncomfortable to get some of these diagnostic tests done. But we do our best to try to make it as low stress for the animal as possible. But it's really important to keep that in mind when we're faced with an animal that's having either vague symptoms or symptoms that can be attributable to a number of different diseases, and we don't have anything super clear to tell us which thing is probably wrong with the animal. If we knew in advance which test was going to give us an answer, we wouldn't really need to run the test. And it's pretty rare that we know for sure in advance. And oftentimes, even when we do have a really strong suspicion of a certain disease, we still need to do the test before we can start the treatment. So for instance, if I have an older kitty come into my office that's been losing weight but has a ravenous appetite, they have a really rapid heart rate and maybe a heart murmur, I check their blood pressure and it's elevated. I'm pretty sure that cat probably has hyperthyroidism because that's super common. But I still need to run their lab work, and I need to confirm that it's hyperthyroidism before I just start treating them with an antithyroid drug. Because every once in a while it's not hyperthyroid. It is something else that looks a lot like hyperthyroid, but that's not what it is. And if I just started treating them with a drug that has potential side effects, I'm not helping them, and I'm potentially prolonging the period until we come to an appropriate diagnosis and an appropriate treatment for that animal. So I do want to address some common concerns before we wrap up today. One of them certainly is cost. This is a very real and very important concern, especially in this economy. So it is important to kind of be prepared for this especially when we have a sick animal. If expenses are super, super tight, you certainly probably can get by with skipping the annual lab work on your healthy patient. I don't recommend that, of course, but that's probably the least important lab work that we run. I'm not going to say that it's not important, because it absolutely is. And if you can do it, you should do it. But that would be the thing that if you're vacillating, if you're like, I'm super stressed out about the fees right now and I just can't do it right now, don't feel terrible about that if your animal is doing super great and totally fine. But try to plan on it for the next checkup visit so that we can keep track, like I said, of that animal's specific values and if things are changing over time. Keep in mind that testing early can prevent more expensive emergencies later. Chronic kidney disease is a really good example of that. If we detect kidney disease early in a cat, we can often manage them really well with diet alone for a really long time. Whereas if we haven't caught it and we're not doing what we can to prevent it from progressing, we're often seeing a cat that's really sick with late-stage kidney disease that needs hospitalization in order to get through that crisis and potentially return to a good quality of life for some period of time. But they're going to have a much shorter good quality of life because we didn't catch it early. So I'm rarely ever hospitalizing cats where I've diagnosed their stage 2 chronic kidney disease before they've ever started having any symptoms. So super rare that we're seeing kitties in that kind of position. Whereas kitties that haven't been getting regular lab work done, that maybe haven't been going to the vet on a regular basis at all, we do see come in critical condition needing to be hospitalized because of their kidney disease. So do keep in mind, if we want to kind of plan for the long term, testing early definitely can prevent more expensive, serious issues down the line, as well as keeping your animals healthier for longer. You also can work on staging diagnostic workup with your doctor. You don't have to do everything all at once. So if your doctor's like, hey, in a perfect world, we would do this lab work and these x-rays and then also this other specialized blood test and all this other stuff. Maybe you can't do that all at once right now today. Start with the tests that your vet thinks are the most important and will most likely narrow things down or rule out something that we really need to know if that's there, and then move on if necessary. It's also okay to stop in the middle. If you've spent $1,000 or more on testing and there's still no diagnosis, your vet may have ruled out enough things to decide on a safe, potentially helpful trial treatment. Or you may decide that you don't want to do super costly or invasive diagnostics or treatments on a geriatric animal or an animal that's having a significant decline in quality of life. At that point, work with your vet to come up with a plan to treat what you can treat, to provide comfort. Sometimes you just can't do all of the things. If you can't spend, $3,000 on an MRI for your animal that might have a brain tumor, sometimes you just can't. And we do what we can to keep the animal as comfortable as possible for as long as possible. But it's important that you do understand when you're making those decisions that we may not be able to solve the problem. So we're kind of stuck between a rock and a hard place when we have either expensive or very invasive diagnostics that we absolutely would have to do in order to get the diagnosis. So say there is a brain tumor. There's no way that we're going to diagnose that without doing imaging of the brain. We can't just know for sure that there's a brain tumor based on symptoms. We can have a very strong suspicion, but we can't know it for sure. So we can't treat it with surgery or chemotherapy or radiation if we don't know for sure that it's there and what type of tissue it is. So we do have to be aware of that. If we're declining further diagnostic workup, you have to do that with the understanding that means we don't have a diagnosis and we can't treat specifically. That doesn't mean that we can't treat. We still can treat for what symptoms we know are there in order to provide comfort. So if we have an animal that's, vomiting, we can provide anti-nausea medication. If we have an animal that we think is painful, we can put them on pain medication. If we're highly suspicious of a certain syndrome, we may give a trial medication if the doctor thinks that that's safe and appropriate to do, that might treat that particular condition and then see how they respond. It's great to keep digging if you can, but sometimes you just can't, either due to cost or due to the stress on the animal. If it seems like the risk or the cost is going to outweigh the potential benefit to the animal, of course, no one should be pushing to just keep testing for the sake of testing. Stress for the pet is certainly a major concern. A lot of tests that we're doing are pretty quick and minimally invasive, if even invasive at all. Most clinics in the modern day, thankfully, are working pretty hard to reduce fear and anxiety in your pets. Make sure your clinic is doing this. Bring it up. If they're not, if you feel like your animal is being handled in a way that's really not respectful of their discomfort or their fear, bring it up. Make sure that your clinic staff and doctors are aware of what fear-free or low-stress handling is. Because some of them aren't. I've been to a few when I've been on interviews and things like that where I wasn't very happy with how the animals were being handled, and I certainly wouldn't do it that way. So not every hospital is totally on top of this, but a big chunk of them are these days, which is really wonderful. So just make sure that you have a kind of a handle on how your animals are being handled, especially once they go into the treatment room. You want to know that the staff that are handling your animals are trained in low stress handling or fear-free handling. But people often do overestimate how stressful it will be for their animal because we are very invested in our little loved ones. I know I've been a vet for a pretty long time, and I worked with animals in medical care before I was a vet. And I still really hate having to take my own animals to the clinic because I worry so much about how stressed out they will be, even though I'm watching them and they're not that stressed out, especially because I give them medication to help them not be stressed out. For animals who do get really stressed or fearful or who are just very uncomfortable, medication can certainly help. So light sedation, medication that you can give at home like gabapentin or trazodone. For animals that have respiratory disease, we might give an injectable mild sedative in the hospital. So if we have a cat that's in respiratory distress or a bird, we may give something to help them just kind of relax a little bit so that they're not having to access more respiratory capacity because they're really nervous. For animals that are injured or otherwise painful, giving pain meds immediately before we do a bunch of diagnostic tests is really important. The pain control, especially for an animal that, has just been hit by a car or attacked by a much larger animal, pain meds right away are super important. So if that isn't already being addressed when you are in with an animal that's in pain, feel free to bring that up and say, hey, can we just get pain meds on board now before we have this long conversation about what tests need to be done and how much it's going to cost and all that kind of stuff. You may also be questioning, are these tests really necessary? And that is totally valid. And sometimes maybe we can get by without doing some certain testing. It really depends on the situation. It depends on the health status of the animal, what's going on with them, and what we are needing to do. Are we needing to put this animal under anesthesia for some reason? And what do we really need to know before we do that? It's okay to ask your vet, what is this test going to tell us? And how is it going to guide treatment? So especially if they're recommending some more advanced testing, like how is that testing going to change how we might treat this particular individual? Totally fine for you to ask that. And it's an important conversation, and one your vet should certainly be willing to have with you and should be able to tell you, I need this information so that I can decide whether this medication is safe to give, or whether this is going to be helpful to give, or this will help us to decide whether it's safe to put your animal under anesthesia, whatever it is. There should be a reason for running the diagnostic test. It should give us some answer that will help us to either decide on treatment or figure out what other diagnostic testing really needs to be done in this particular situation with this particular animal. So ask questions. Make sure that you feel comfortable, that you understand what the recommendations are. Oftentimes, if I'm seeing a patient for a second opinion, often the client is a little confused by what's been recommended. They're not sure why. The other vet said we need to do this, this, and this. None of this makes sense to me. Like I'm not familiar with these tests. I don't know why they need to have them done. So it's really important that the doctor has clarified what the tests are and why they want to do them, and that you feel comfortable that you understand why this is being recommended. Be sure to keep records of past results for your pets, especially if you've moved, you're going to a different vet. Having your previous records, it's super helpful. As I mentioned before, keeping track of changes throughout the lifetime of an animal is really, really helpful for us to know if something is changing for that animal. And follow through on rechecks, especially if abnormalities were identified or a diagnosis was made, or your pet is on a medication. Those follow-up diagnostic tests are really important to make sure that we're getting the response that we are looking for, and also in some cases that we're not having an adverse reaction to treatment. I hope that helps to clarify kind of the diagnostic rabbit hole that we can sometimes get into. I know that all of that testing that can be recommended in some cases can be overwhelming, especially with the costs and all of the different testing. And sometimes your vet is saying, there are these 3 tests that I would like to do, but, all of these together is like $2,000-$3,000. So, this one might tell us this, while this other one might tell us that other thing. It can be very overwhelming, and just trying to get an idea of, okay, how can we approach this in the least invasive way? How can we approach this in the least costly way, or at least break up the cost so that it's happening over, a little bit longer period of time? Have that conversation if you need to. If money is no object and you want all the information and let's go for it, then that's great. But that is often not the case. So be sure that you're addressing that and having that conversation. Also, on the subject of cost, there are some places where you can get some assistance for covering costs. So do keep that in mind. Places like Care Credit and Scratch Pay can help with a short-term loan to kind of break up that expense into payments for a while so you don't have to deal with it all at one time. And there are some nonprofit organizations and some state organizations that may have grants, which may be small, but even if it's $200 or $300 to help you, tackle that $1,000 of testing, it's still helpful. So always worth checking if your doctor knows about any of those, or even doing a Google search, to see if there are organizations around you or national organizations that may be able to help with some financial aid. So don't forget about that as an assistant when you're looking at some costly diagnostic testing. I hope that helps to clarify and helps you feel a little bit more comfortable with how, when, and why diagnostic testing is done on your beloved pets. If you found this helpful, please share it with your friends and loved ones who are animal advocates as well. And if you want to stop by your podcast platform and give me a like or a review, that would be great. Thank you so much for joining me today. And the next time your beloved little animal needs a blood draw or a urine sample or any other kind of pokey, give them extra big hugs for me. I hope you enjoyed this episode of Dr. A for Animals. This podcast is for educational purposes and does not substitute for specific medical advice for an individual animal or constitute the practice of veterinary medicine. No veterinary client-patient relationship is formed through listening to the podcast. If you have an animal in need of medical care, please see their veterinarian.